In the last module, we talked about the recession and its impact on veterinary medicine. What's interesting, though, is if you go back and look at a lot of the reports, the studies, the figures that are available that give us some insight into veterinary medicine, there were a number of very interesting trends developing quite a few years prior to the recession. And those are trends that are continuing to impact our practices now, probably made worse by the recession, but that even if we hadn't had the recession, we were going to have to deal with. So let's talk about a couple of those right now. In 2004, the AVMA Pfizer Business Practices Study was released, and one of the questions in that study asked practice owners, what actions are you going to take to improve profitability in 2004 or in the next year? And overwhelmingly, practice owners said, we're going to raise fees. 95% of the respondents to the survey said, yes, we're going to raise fees. And there wasn't any other action that they could select that had greater than a 50% or actually greater than a 49% response rate. So the biggest thing that we were going to do to improve our profitability was raise fees to clients. And what's interesting is that when you go back and look at the fee levels from 2004 to 2006, you will see that we were true to our promise. We raised fees, and very, very dramatically. 76% of the fees during that time period increased above the rate of inflation. And that above the rate of inflation comment is important because inflation during that time period was roughly 6%. So when we say that, we note that 67% of anesthesia fees increased 11 to 24% above the rate of inflation, what that really means is those fees increased 17 to 30%. 72% of treatment procedures increased anywhere from 6 to 22% above the rate of inflation, and 60% of surgery fees increased 8 to 54% above the rate of inflation. Surgery fees were some of the most dramatic increases that we saw. Now, the rate of increases slowed in the next 2 years from 06 to 08, but fees didn't decline. So those higher levels of fees were here to stay. During these same years, we've also seen some other very interesting trends. And what's important for us to try and understand is if there's a correlation. So during this same time period that total revenue grew from 7 to 11%, we also saw transactions per full-time equivalent veterinarian flat or declining. We saw the number of median new clients per full-time equivalent veterinarian declining. We saw the number of median active clients per full-time equivalent veterinarian declining. We saw total veterinary visits decline very dramatically and primarily because of a drop in the number of cat visits. We saw veterinarian visits per pet declining, and we saw the percentage of households with pets who visit a veterinarian also declining. So this information comes from multiple sources. Some of it is based on studies of the veterinary practices. Some of it is based on pet owner surveys, but we're seeing a similar story no matter which resource we look at. If you look at pet owner and client studies, they will tell you that pet owners are not afraid of spending money at the veterinary practice. So studies will say things like 76% of pet owners would spend any amount necessary to keep their pets healthy. 52% of pet owners say they always do exactly what their veterinarians recommend, even if the treatment is inconvenient and time-consuming. Only 20% of clients say they will decline care because they can't afford it, and 74% agree with the statement that a visit to the veterinarian is well worth the dollar investment. And yet, when you look at other sources of information, some of this doesn't appear to ring true. When you look at other studies and you look at how much people actually spend at the veterinary clinic versus what they say, you'll find that being a pet owner doesn't mean you're a veterinary client. There are a large number of pets who are not getting basic care. According to a very robust, a very large study done by the AVMA in 2006, almost 24% of pet-owning households spent nothing at a veterinarian's during that year. 27% of pet-owning households spent just between $1 and $199 a year. And this is pet-owning households, so that's not per pet, that's per household, which means a household could have 2 or more pets, and everybody knows that $199 doesn't go very far for one pet, but really doesn't go very far for 2 or more. only 22% of pet owners or of pet owning households spent over $500 a year. So there's a lot of pets that are not getting all of the care that they need. In addition to the study done by the AVMA that showed how little was being spent on the average pet, another study looked at some of the detailed places that clients spend money. And what that study saw, and this came from the 2010 AHA State of the Industry report, this study showed that the percentage of dogs getting one or more doses of heartworm preventative in 2009 ranged from 21 to 43% depending on the region of the country. That's a pretty small number of dogs that are actually getting any heartworm preventative at all. And if you looked at the numbers of dogs that were getting a full 12 doses, which is the recommended amount by most veterinarians, the numbers were much less. And if you looked at the number of cats who were getting heartworm preventative, it's abysmal. So no matter how you look at it, there are a large number of pets who don't get all of the medical care that they need. So this raises a couple of interesting questions. The first one is, are fees a problem? And are fees the only problem? No doubt we have an increasing number of veterinarians out there. And so if you take the pet population and spread it out over more veterinarians, you're going to see less cases per veterinarian. However, the number of pets are increasing, and in spite of that, we're seeing a decline in the number of transactions that each veterinarian sees. We know we've had a change in vaccine schedules, and that is likely pulling down some of the transactions, some of the visits to veterinarians. We know that pet owners can get some of the products they've traditionally bought at veterinary practices from other channels like on the internet. We know, or at least we think, that pet owner attitudes towards where they get their pet care information has changed. No doubt there's been changes and will continue to be changes in post-recession consumer behavior, so consumers aren't spending as much on anything. We aren't sure that as veterinarians we are providing the kind of healthcare environment that all pet owners want, that there are cultural differences and ethnic differences in how people approach where they get their pets' healthcare needs met. And we think that there are also service issues, so convenience issues, communication issues that may be impacting why people are visiting the veterinary practice less than they used to. One of the other related issues has to do with, do we really understand what pet owners want? If you look at the median household income in 2009 in the United States, it's $49,777. That is not a lot of money. And so pet owners may desire veterinary care but not feel like they can afford it. And that's definitely something that ties in with some of this fee increase information that we've seen and would seem to indicate that the amount that we have raised fees may be starting to become a problem. We know we need to deal with the cultural and the ethnic diversity. We need to understand how pet owners of all different kinds of cultures want to get their pet health care. And we need to look at niches within veterinary medicine. Our focus in many, many practices is to be a high-touch, high-tech practice. So a high-end practice, charge high fees, but provide good value and a really good customer service experience. However, there are many pet owners that either don't want that or can't afford it and are looking for a different kind of a practice. And we don't seem to have as many practices in some of these other niches to serve those portions of the pet owning population well. An example of one practice, if you looked at the bottom quartile of clients in that practice, they spent about $80 a year, and the top quartile spent about $1,500 a year. So there is clearly a range of pet owner needs and pet owner ability to pay and pet owner activity. And there probably needs to be a range of practices aimed at these different pet owner segments. Some of the most profitable practices that I've ever seen are ones that were essentially wellness clinics. They provided very basic care, so vaccinations, heartworm preventative, heartworm test, flea and tick products, a little bit of care beyond that, but they did it in a low-cost manner. They saw a lot of patients. They were very efficient, and it worked well for those pets and their owners and for the practice. Obviously, all of this has to be within the standards of care, but standards of care are relatively broad, and you don't have to offer only gold standard medicine to be within the standards of care, and there are a large number of pet owners out there for whom that is necessary. Not to say that we don't provide the high-touch, high-tech, more expensive practices for people who want them, because that's a niche as well, and many pets are well served by that, and many pet owners are well served by that as well. Interestingly enough, when we ask about fees in the July 2010 NCVI Quick Poll, fee increases are not nearly as dramatic now as they were before, and of course that makes sense given the recession. About 18% of practices said they weren't raising their fees at all. About 1.5% said they were lowering their fees. About 46% said that they were raising their fees, but only between about 1 and 4%. Another 30% of practices said that they were raising their fees between 5 and 8%, and then a small number were raising their fees at levels higher than that. So what this is all telling us is that we need a better understanding of pet owners and what they want and how they want to get their veterinary care, and we need to look at the impact of fees and how we set them, as well as the rest of our business models, to make sure that they're meeting the needs of the pet owning public. The NCVI is involved, along with Brackey Consulting and Bayer, in a veterinary care usage study whose results will be available later in 2010. And the specific point of this study is to understand some of these questions that I've posed here, which is, why are veterinary visits declining? What's driving that decline? And so is it because of fees? Is it because the pet owners are getting their information about pet health care elsewhere? Is it because of convenience issues, service issues? There's a whole host of questions that are being asked in this survey, and I think we're going to see some very powerful results. So things that we can do as a profession and as individual practices in order to increase the number of visits to veterinary hospitals.